right, Denny. Thanks, man. Hey, listeners. Hey, welcome to another episode of Broken Brains, the only show in America that we know of right now that's focused on the huge problem that's being caused by repeated head impacts in sports, repeated blast exposures to our military personnel, and the enormous amounts of suffering and silence and mental illness that's accompanying individuals that have been exposed. With us today is a very special guest because she's in an area that I really want to dig into. It's Dr. Janelle Royster, and she is a psychologist out of Lakeland, Florida. And we got introduced by one of our second guest on the show, which was Marissa McCarthy. So, Dr. Royster, tell us a little bit about yourself. It's a real pleasure to have you on the show.
Well, thank you for inviting me. Thank you for Dr. McCarthy for connecting us, and thank you for your service. So what I do is very interesting. I've had a lot of trauma myself, and with that, I had to figure out a different way than talk therapy. So for me, it was after I received my doctorate, I decided to get help, and that didn't go so well because talking about my betrayal traumas, I had a very negative reaction to talk therapy. So I luckily went back to school because, doctor, heal thyself. And I got a second master's in clinical mental health counseling. So I have an associate's in nonprofits, a bachelor's in psychology, a master's doctorate in industrial organizational psychology. So I'm a psychologist, but I am not a clinical psychologist. So the degrees are considerably different because an IO Psych is more about streamlining and simplifying, and you kind of associate business with psychology together. And then I went back to school to get licensed on a licensure track to get a clinical mental health counseling. I was on 12 different medications. It was not great. It was just, basically treating one medication with side effect after side effect after side effect. So for me, I knew there was a better way, just didn't know what it was. When I graduated with my master's in mental health counseling, I met a few people who had served like I did. I served in the Air Force. They served in the Army, National Guard, several other places. So I was lucky enough to bond with some of those people. Yes, sir?
No, I said thank you for your service to them.
You're worth it.
Yeah. Yeah, they are.
So I decided to kind of follow his lead, and he's dragging me around to all these different trainings. So now I'm trained in about 37 different therapeutic modalities.
Wow.
One
That's a Chinese menu right there.
Anyone. Yes.
Right. Yeah.
So, and they talk a lot about trauma and different interventions. So you have trauma-focused cognitive behavioral therapy. You have prolonged exposure, which is what the VA used to put everyone through. Now you have eye movement desensitization reprocessing, which is the big one. Accelerated resolution therapy, reconsolidation of traumatic memories. So for me, I got certified in everything trauma related I could find so that I could help myself, so that I could help other people. But what I've realized is there's a lot of therapists and psychologists out there that get trained in one or two different modalities, and they just kind of stick with that. It's like, that's what's worked for me, so that's what I'm going to choose to use with you. And a lot of people who go to therapy have a preconceived notion that it's going to be talk therapy. You have to talk through every feeling you have. That's not necessarily true. With us, I mean us, because I created a private practice, and now I'm currently getting a second doctorate in traumatology, so I can specialize.
Traumatology. That's like a specialty.
Yes, it's a study of trauma, specifically designed for those who deal with trauma-focused individuals, individuals who have been through significant trauma. When I started out, you have to do your internship and then your clinicals and all this. Well, I worked in an acute care psychiatric facility first. Where does all the trauma go? There. The reason they call it a revolving door is because you will do all the completion of the intake paperwork. You bring an individual in who's really struggling. You get them on the right medications, and then they leave. Well, 30 days after that, they may not be able to get to the bus. They may not have money for the next prescription, so there's so many varying factors, so that when they stop taking their medications, their symptoms come back, and then they're back in the acute care because they're behaving in such a way that they don't have a choice. Because if they don't have money to take a bus to get a medication fulfilled, luckily now we have everything. This is after COVID, but this is back, 15 years ago. We didn't have the benefits we have now with telehealth or doing podcasts like this, right?
Right. No,
So
absolutely.
after that, I worked in a psychologist's office, and we worked with human traffic survivors on the south side of Chicago. So that was interesting. So I continued to be exposed to individuals who were struggling through their traumas. And having my best friend die of suicide, and, I have an ex-husband who put a bullet in his chest while I was on the phone with him. So those are the huge traumatic events in my life. And those are what transitioned me into being trauma focused and helping as many people as I can. Well, luckily, the way my brain works, because of all the streamline and simplify education I've taken a myriad of different modalities and connected them together and created what's called trauma recovery intervention protocol. Now, this is a visual imagery process. I use numbers within, and it streamlines the process without anybody having to tell me, one, how they feel, because sitting in those feelings is something you do all the time. I don't need you to do it with me.
No, absolutely.
And you don't have to tell me your story. We just go through this protocol.
So these protocols, and when we deal with the brains that we're talking about, they're heavily impacted by contact sports or military service, especially blast injuries, and of course trauma. Seeing dead people, being able to or being asked to perform horrific acts in order to come back to your family. We noticed that with the VA and a lot of the programs that they go to, it's therapy and drugs. There's not a lot of treatment options, even though we know there's a lot of treatment options now that are available, not covered. So do you use, before we get to that, so the therapy practices that you use right now are visual? Are they designed to not use pharmaceuticals at all,
Yes.
or to try to minimize that? Because that is the number one concern we're hearing from parents and, soldiers, parents of children, the athletes themselves, and soldiers. Just, I don't want to be on these drugs. These drugs are not doing me any good at all.
Well, like I said, I was on 12 different medications at the same time, and one of those was a depression med, and I was by no means depressed. And I actually had active visual hallucinations on that medication. So rather than take me off that medication for depression that I didn't have and no one screened me for, so there were no evaluations done to determine if I was truly depressed or not. They just told me I was because of what I went through. So they put me on a medication, then another one, then another one. By the time I saw, there was just one day I opened the medicine cabinet and there were 12 medications with my name on it. And I just grabbed them all and dumped them in the garbage. Now, I will tell you, there were considerable. It's no different than getting off any drug that you're addicted to, So I had to go through a series of processes that I knew about. Luckily, as a therapist, there are things that I can use that I advocate to my clients that I can pull these resources, right? But a lot of people don't have those benefits.
And these
I
were
met Dr. Duturi at a fundraiser. He's also known as Dr. Deep Sea. And I'm sure you met him. He spoke at your conference, you said, and he's a very, very, very good friend of mine. I met him, and he saw the benefits of my work because I put him through it. He called me on a Sunday, and he was going through some things, and I showed up at his house because that's what I do.
Wow.
So I drove about 2 hours to get to him, and I ran him through a couple protocols, and we've been friends ever since. But what happened is, after this event, because he was a Navy commander for about 28 years.
He was.
So he's been through lots and lots. Plus, diving at almost 3,000 feet, like that's intense on your brain. Yes, ma'am. So he got into a car accident where he was T-boned, and the hospital had sent him, and I'll let him tell you his story. but there were a couple protocols that I put him through that really helped. So he decided he was going to pave the way. And what he did is he created a hyperbaric clinic. And what it is it's a bunch of veterans a bunch of veterans. And he did a study with the University of South Florida because that's where he's a professor at as well. So he owns H2O, which is a hyperbaric oxygen place right off of West Shore.
Okay.
And then he did a study with USF. It was a small study. I think he had for like 40 participants with individuals, veterans that had traumatic brain injuries, and then 40 sessions of hyperbaric medicine. And it was life-changing. But on top of that, he was also doing a TBI clinic, which is hyperbaric exercise, nutrition. They work with me, once or twice a week. They have physical therapy, massage therapy. And the massage therapist does this different type of therapy where it's your occipital lobe in the back of your neck, and it's just unreal. Yeah. Huh. So there's a chiropractor involved. There's just this whole person wellness program. But the challenge is, I'm sorry, no medication. No.
Yeah. That's so important.
And we do recommend, so there is another veteran, his name is Scott Yontz, and he practices out of Tampa as well. But what's cool about him is him and his wife, I think his wife is a doctor, and they work side by side. And what he does is he does an assessment, and then you go get a blood panel done. And then you take it back to them, and they determine what amino acids and peptides that you're deficit in.
Okay, yeah.
And they give you what you need so that you're not looking for. The only challenge, I know there are a lot of people, and I'm not pro or anti-medication, but I will say that we don't know what it does to the brain. Unfortunately, because these medications are universal and our brains are individualized.
I keep hearing that as a theme. That's why there's no single silver bullet for mental illness, or especially
I'm working on it.
The brain. Yeah.
Trip is doing very well. So I will say it's a neurological intervention that disconnects the emotions from the events. So what happens is your brain doesn't understand chronology. It has no idea that something similar that's happening now to make you angry happened when you were 8 years old. It just thinks you're 8 all over again. So on a subjective unit of distress level is what we use all the time on a scale of 1 to 10. You go into the primary care physician's office and you have this lovely little scale, and it's got a bunch of happy faces on it, right? And 1 is angry, and 1, where you're in the most pain. 10 is the most pain, and 1 is being happy. That's kind of how we assess where people are emotionally. So we really focus on, like, where are you at? Are you at a level 3? Do you feel it? Does it feel farther away? So when we go through this protocol that only takes 6 or 7 minutes, what we do is we see the shift. We see the shift in the person has let go, per se. Because the challenge is our prefrontal cortex sends us down rabbit holes. Well, what if this? What if this? What if that? Right? Because our brain is always trying to find a solution to a problem. And sometimes when you have a traumatic brain injury, the highways are no longer connected.
Right. Yeah, it's absolutely. Yeah. I mean,
so that's one of the reasons the benefit of hyperbaric is because that's 100% compressed oxygen, and it opens all of that back up.
Yeah, I mean, the work that Joe's done right now with HBOT is really promising. It's it's how do we scale it? How do we make it available? How do we,
Well, so
because
he just received a huge grant, and he's going to he's got 6 hyperbaric chambers. They just got him in. He showed me pictures 2 Sundays ago, and I saw him at an event. I went to a dive fundraiser, and he was there. So, they got 6 new beds, and I'm pretty sure they're going to treat up to 600 veterans in the state of Florida.
Wow. Good for him, man. I mean,
isn't that amazing?
We need more studies, for some reason, HBOT's considered, and on the edge where the stuff that you seem to be doing, the protocols that you've developed right now are a little bit more acceptable within the medical community right now. I mean, it's
You would be surprised. I do
really
contract with a few companies. One of them is called Telemind, and I contract with them as a clinician. And you're only allowed to use evidence-based protocols. So but the thing is there's no harm done in some of these interventions. I mean, if I ask you what your favorite food is, that doesn't harm you.
no.
But that's one of the questions in the protocol.
Well, the issue is that the evidence-based protocols have failed to provide the relief or the improvement in our suffering veteran populations, and we're not even really using them for our that's all we use for our children right now, and we have no indication of understanding why they might be suffering. As a psychologist, have you ever received training in the area of repeated head impacts, repeated blast exposure, and the links to those to brain damage and the subsequent mental illness that arises from that brain damage?
Yeah, there are a lot, and it's typically because the same area, like I said, the neural highways, that's what I call them, right? Neural pathways,
Right.
neural
Yeah.
highways.
Yeah.
The highways of the brain are actually broken.
Right.
And there are different ways that you have to approach those. And, Dr. McCarthy sends me a lot of clients because part of it is if you don't heal the brain, it's hard to heal the body, right?
Well, the problem that we're having right now is that because of subconcussive trauma, unlike a TBI or a concussive event, there are no symptoms. There is no known damage to the brain. So these individuals are they're coming to psychologists and they're going in front of them and they're being like, when I lost my son, I went to a psychologist. You're going to end up in front of one. And she's
Right.
looking at me. She goes, our entire community is not trained in this issue. So these kids come in, they have no known concussive past, no known TBI past. They're being evaluated as crazy children, and nobody's asking them, hey, how long have you played contact sports? And that's what, to your point, damages their brain. And that's where your protocols are so valuable, is that you're coming up with a different way of addressing this damage. But first of all, we got to get these kids and veterans and adults assessed for long-term exposure and the damage, because if they never had a TBI, then you as a psychologist thinking I'm just dealing with a PTSD case or a crazy person. No, that guy's shot thousands of 50 caliber rounds, or he played football for 20 years before he joined the military, whatever it is. Right. And,
Right.
So we really got to start getting this education expanded. For you to be informed on that, I mean, is amazing, because we don't run into a lot of psychologists, and the need is dire to put this in education somehow.
Well, I agree wholeheartedly. And I think you're spot on with regard. I did go to a conference and I saw, there were a couple people that were talking about like neuroscience, cognitive behavioral therapy. And I also think it's got a lot to do with our intakes. When we first take on a client, because I am in private practice, so I get to see the business side of it, right?
Right.
And normally, you contract with a therapist, you give her a client, she does what she does, and they're on their way. Whereas if you're a business owner, you see a little bit more of that, and you can go, okay, on this first mental health intake, so that I get to know you, like, what are the common questions? But for me, because I'm trauma focused, I have to ask different things. And sometimes when you have a child who comes to you and they're 13, 14, 15 years old, and there's been no significant life changes. Nobody's getting divorced. Nobody has passed on. They have all the same friends. Nothing has changed except for the fact that they've been playing hockey since they were 7.
Right. But
So
you asked
those
that
are
question.
questions. Yes.
Most psychologists do not. And that's what we're trying to understand is how, in your opinion, how would we expand that awareness? Because it's just like in the military now. They're now starting to understand the importance of how long have you been a Navy SEAL or Green Beret, or how many blasts have you exposed to that didn't cause symptoms, right? We're looking at lifestyles now. So how do we get these lifestyle questions into psychology so that the average psychologist out there, if you're mentally ill, I mean, there is a statistically significant sampling of the child and adult populations who are playing or who have played extensive amounts of sports in their lives, but they're
Correct.
not being, and sometimes the symptoms won't emanate for 20 years, right? All of a sudden I'm 35, 45. I have this midlife crisis. I'm going to run down the street with my 25-year-old neighborhood. I'm done with my family. And
Yeah.
nobody said that guy played hockey from 7 all the way through college, right? How do we, because that's what, our foundation is focused on, is expanding the awareness of this issue so that we can identify people that need your modalities that are properly aligned with the causality that put them in front of you in the first place. How do we get that all started?
I think it's creating awareness and letting people shift their thought process, and also, making these standardized intakes and have them elaborate on them, because you can ask 60, 70, 80 questions on that thing. And yes, it's tedious to you as the client, but
Yeah,
at the same time, how much time do you want to spend in therapy? Do you want 8 sessions or do you want 42?
Right.
I prefer
No.
8.
And you're one of that's the other side, is that how do we get off this, this ka-ching, wheel in psychology where, we have to get these people back to work, on the job, parenting, the whole 9 yards. You have a remarkable, perspective on this. It's very enlightening, and I really appreciate it, to tell you the truth.
Well, I rejected the snot out of therapy, which is why I have to do it different. So for me, I've been so lucky to be exposed to the individuals I've been exposed in. I have a dude who's a diplomat in hypnotherapy. So if you can't seem to let something go, he will help you. and he's Army. So he just talks at you and you feel better. I don't understand how he does it.
Really?
Yeah, I close my eyes and he's talking to me, and I'm driving on this windy road. I visualize this, and all the trees are hanging over the road, like that southern moss, and because I'm in Florida.
All right, I need to
in a
see
back
this guy.
road, and all you see is the trees kind of hovering over the road, and then I don't know, 7 minutes later, I feel better. I have no idea what he said to me, but that's the difference between clinical hypnosis and talk show hypnosis, where they make you bark like a chicken. That's not things we can do. We don't make anybody bark like a chicken or dance naked and, sing Bob Seger songs. That's not a thing.
No.
So don't be worried. But what it is it's kind of talking and breathing and kind of giving you a different perspective. And what it does is it slows down that prefrontal cortex, the thing that's causing you anxiety, fear, the hesitation of trust, right? So when you're with a therapist, you want to be able to trust this person has the skills to help you get better. Now, I also tell my clients, I am not the person that's going to sit here and go, I understand. I hear you. Wow, that must have been difficult. That's not me. I have other therapists that will sit.
I can tell.
And they will listen to you, and they will let you verbally process, because it's all great. It's whatever you need. Look, you need to be jumping up and down on a unicorn and singing Kumbaya. Go forth. I don't care. There's a lot of people who talk about ayahuasca and MDMA and microdose and psilocybin. Okay. Ketamine. Sure. What do you need in the moment? Because we need to get you from the point where you're thinking about choosing between a bottle and a bullet.
Yeah.
That's my concern. Let's get you away from that.
All right.
And then we'll focus on the other stuff. But I'm very direct and very focused.
Explain, if you could, for the audience, the difference between your approach to psychotherapy and CBT, right? Cognitive behavioral therapy, some of the more evidence-based approved therapy models that just aren't working. I mean, I'm part of a research my own personal research project where I'm using a lot of different psychedelics. I'm going to retreats like for psilocybin, ayahuasca,
Yeah.
ketamine, and because there is on the treatment side, evidence they do improve brain function. They rewire the brain because we have brain damage. We don't just have we have, the highway problem, right, that you were talking about. We have chemical imbalances, hormonal imbalances, but we've got structural damage that we have to fix. And these
Correct.
things talk won't fix this, right? So we need to, we have this other aspect of the
You're
brain
a
called
whole nother
treatment.
level.
That's another, well, it's just another aspect of it. We have,
Mhm.
a little bit of, drugs when necessary, lots of therapy that works like yours. And then we get the
Well,
treatment
those
options where,
drugs also create new neural pathways to build brand new bridges to get you from A to B.
okay, and which drugs are you talking about that do that? Because
Psilocybin, MDMA.
oh no, the plant medicines, absolutely, yes.
Yeah.
The pharmaceutical drugs, I don't think are known for that.
I think they
Those type.
calm down. So there are people, and I'm not gonna. I don't go either way. I am
Right.
very client focused. So for me, I don't happen to be on any medication. I was diagnosed with complex post traumatic stress disorder because I had some childhood trauma, adult trauma. My situations are very complex and
Right.
intertwined. So I got diagnosed about 12 years ago, I think it was. And what I've learned is what works for me may not work for you. So let's figure out what works for you.
Mm-hmm.
You
Yeah,
know,
each brain's a
I'm
snowflake.
that therapist. I'm not going to sit here. It's not, you need to do trip. No, if it doesn't work for you, that's okay.
How do you recommend that individuals suffering that from mental illness find that that balance between medication, therapy, and treatment options that are out there? Is it purely experimental? Is it based on the types of trauma that they have? You could make some recommendations to give them a head start. We're looking at some legislation now in Florida. We've been approved. We're submitting it now, where we're going to look at treatment options, therapy, psychedelics, things that are not covered by insurance plans, because we can't let veterans just die anymore, man. We get if these things, all of them have had thousands of veterans say, hey, this helped me, whether it's ayahuasca, ibogaine, psilocybin, your therapy models, H5, photobiomodulation. Why aren't
TMS,
these
whatever
available?
works. Yeah.
Right. Why aren't these available to veterans? And if there are this multiplicity of modalities on the, medication treatment and, psychedelic side, how do
I
we
will
help
tell
these
you that
veterans
the VA
find
has
that?
sent me a significant amount of veterans lately. I got on their, I think it's Community Care Network,
Right.
something like that. You sign up for, and then the veteran will say, I want to see Dr. Royster. And they're like, oh, she's on our list. And then they fax me a form that says that they're approved. And that way I can take TRICARE, because sometimes I automatically get it and other times I don't, but I take insurance. And then if they do have a copay, I get that sponsored through a nonprofit called Project Vet Relief. It's a
Nice.
nonprofit arm of the American Legion, and they help a lot of veterans with funding and resources and connecting them to whatever their needs are. There's a place in Tampa, and she actually cleans houses, and she's an Air Force veteran, and she did so well in the private sector, as with the civilian, she decided to pay it forward, and she's creating a cleaning nonprofit organization that assists those with disabilities. So veterans who can't clean their house because they're struggling, I
Right.
mean, a lot of us already have a rating,
Check.
you know.
Nah.
So
Yeah.
uh
That is super sweet, man. That's good for
yeah.
her,
And then
man.
I have other nonprofit organizations. There's one called SOF Missions. It's a 4-day clinic that does mild traumatic brain injury work.
Okay.
And it has, chiropractor, massage therapy. It has a lot of group work, physical activity, mental health. So I'm a provider for that as well, because I went through it, realized its benefits, and decided to become a
Mm.
practitioner there. So I'm there sometimes. They have 2 female groups. They run in April and October, and then the rest of the time they're male groups. So they stick the same sex together just in case someone is struggling with military sexual trauma,
Mm-hmm.
to kind of alleviate that aversion. We don't want anybody. We want everybody to feel welcome and accepted. There's another one. He's out of Webster. He's actually running for sheriff. His name is Eric Ryan Anderson. He's running for sheriff in Sumter County. So he's a Marine who was a police officer, and then he was a volunteer fireman, but he owns a ranch and he's got like 10 or 12 horses. And he'll take you out there and do mounted shooting, which is like a cool kid's way to blow off steam. But he's got a nonprofit that's sponsored by Project Vet Relief. So he brings you out there for free.
Wait a minute. So I've heard of equine therapy. You're talking about shooting on the backs of horses?
Yes,
like
sir.
Shooting from a helicopter? And those horses
shooting
don't run
off
around?
the back of the horse, and all of the horses are trained.
Dang.
Any horse you pick. Yeah, the wife is a world champion. I believe he is too. He was on the TV show Top
earplugs
Shot.
on those horses?
Yeah. No, the horses are used to it.
Dude,
they don't even nudge. They don't nudge. They don't notice nothing. They know the bam, bam, bam. Because you're shooting balloons.
That's
so it's safe.
It's not the balloons. It's the gun. It's the rounds going off without. That's loud, man. For a horse
they know
too,
where
they
they're
can
going.
hear. I guess, man. All right.
They're conditioned.
Well, good for him. We need more Marine sheriffs around here. But okay, but back to the question: like your approach to therapy obviously has been refined through your personal experiences.
Yes.
At what point should anybody consider talking to you, because it sounds like you've stumbled onto something that is relevant, is innovative. It's not widely practiced, and you got people being sent to you from the VA. So that's that's an indicator that you're pressing a button. So what do your modalities? You just, like you said, it's mostly visual, right? Is that the significant difference, or?
It's vision. Well, I use numbers. So if you find somebody who is extremely anxious and in distress, now this cost me about $60,000 to learn, but I'll share with you.
No, so, you share what you can. I'm not looking for the secret sauce or your magic.
It's so simple, stupid.
Yeah.
Like when a kid is misbehaving, you say, you better fix your attitude or I'm going to come over there. 1, 2, and they behave, right? It's because you're shifting hemispheres of the brain. So what I've learned is complex numbers disconnect emotions.
Okay. Good. All right. Well,
and that's part of my protocol as well.
And that's working for you. Mm-hmm. That's working for them, more importantly. Wow. Okay.
So it's a neurological disconnect that you immediately feel relief. Like as soon as you go through it, most people take a big deep breath and they're just like, it's gone. It's farther away. I can still see it, but it's farther away.
Doesn't bother me as much.
Right. And that's the idea. Cool. We want to get rid of the visceral emotion. Dr. Vanderkolk talks about the body keeping the score. And it's basically, the information comes through your prefrontal cortex because that's in the front, right? Typically. Runs through the neural pathways into the amygdala. The amygdala checks whether or not it's safe. And if it's something that's happened before, like, your brother took your toy away when you were 8 years old, so you were angry and it was unjust, right? How dare they take it away and they let him take it? Well, that continues to happen in our life and we have all these patterns. Well, so when you get to the injustice of somebody cutting you off in traffic, you're losing your mind. Right?
Okay. Yeah. It's injustice.
So what does it look like if we take care of the little 8-year-old who felt injustice? It alleviates everything else and it brings that number, that level 10, down to a 1. Right. So that is like the goal with the protocol.
Okay. So you're able to get them to find that 8-year-old that moment in time, which is tied to, when
you ask for it, they can pull it up pretty quickly. And a lot of people with traumatic brain injuries don't understand that they've had things happen before in their life to trigger these reactions. So Dr. Tuturi had me work with an individual who lives up north and, he was in a horrific accident. He should not have lived at all.
Wow.
And now he's just thriving.
Well, that's amazing.
He's still mad at some of his family members, but some things are legit.
Well, if you have a car accident and you're mad at your family, that's going back. I know that undergoing ayahuasca, you're able to I was remembering things. And under ketamine, I remembered memories, like fond memories of my son that couldn't remember anymore, just
Oh,
because
that's
all the
awesome.
grief and stuff, So if you're getting there without, getting an IV in your arm or, because those ayahuasca, that's work, man. That's not, anybody thinks that ayahuasca is a recreational drug. No, it's a
All
lot
I
of
hear
work.
about ayahuasca is that, yeah, I went and vomited and I found I went on a visual journey or something. And I'm like, oh, okay.
Yeah. No, you
What
find,
was the end result? That's all I care about. Like,
yeah,
what happened afterward? Did you get sleep? Because you haven't slept in 6 years. Like, what
check.
happened?
No,
But
and
that's
that's
the
where the
focus that Dr.
combination.
McCarthy has. She specializes in like sleep hygiene.
Mm-hmm.
So I'm constantly just regurgitating everything she's ever said to me about sleep hygiene.
No, I mean, it's so important. I mean, so many people don't get it. It's a number one. I mean, it's actually, I do believe, contributed to my son's decision to take his life. He wasn't sleeping.
Well,
And,
and if they ever did a study on it, behavioral patterns of people who have a suicidal attempt or plan, the majority of the time is they haven't slept in the past 72 hours.
I wouldn't doubt it. I wouldn't doubt it. He was done, man. And I just, I wouldn't even know what I would have done if we would have found he was struggling, because we had no idea now, like we know now, because back then there was no information on,
Right.
RHI and brain trauma. And, we deal with so many families that have had their children arrested or because they act out. My son never acted out. He was just a good boy. He just ate it till he couldn't eat it no more and decided to leave me behind. So, but I didn't have any cause. So that's what
But did he have any? I mean, how old was he?
17. Yep. The
That's
only
hard.
thing
I'm
we
so
can look
sorry.
back. Yeah, the only thing we can look back and really identify as being mental illness was apathy. And he just really didn't care about too much. But we had a blessed life. And he's 17, getting ready to join the Army. And then I just remember the day before, his eyes were really red. And I asked him, "Are you doing drugs?" He came up, and I just don't think he slept. And I think he was just done. And even if we would have, I'm surrounded by him. This is his whole room. Everything he had is all right here. And, if he would have talked to me or, he just didn't, he was done. He's been suffering with schizophrenia for 2 years, depression for 3. And he left us a video and then ran off a rip. He posted it on Snapchat and boom, took off on me. So, but that's why, we became very involved with the psychology side of this, because, it's this subconcussive trauma, its impact on the brain, and mental illness is not trained in any institution of medical learning. It's not trained to nurses, doctors, and it's not trained to psychiatrists and psychologists either. So the first line of response for a parent when a kid's suffering, and the number one indicator of a damaged brain is mental illness. And nobody, like you said, your intake forms, the fact that you have this in there, nobody is educated to ask on that intake, hey, has Tommy played or Susie played? We've had girls take their lives who like to practice hitting the soccer ball because everybody thinks that's innocent. But every time that ball hits, that brain shakes, stuff shifts, things get damaged. And after years of doing it, you've got a damaged brain and a damaged adult. And
yeah, there's a quarter inch between the floating brain and the dura, and I don't think people understand how little it takes to damage the brain.
No,
but we have 2 million megabytes of information that come in your brain every single day, and if you're not sleeping for 72 hours, that's 6 million megabytes of data just floating around, not going anywhere. Because when you sleep, the REM is super important because you process the information and you store it in the files where it belongs. But the deep sleep is super important because that's where you're healing, right? You're healing your body, you're healing your brain, you're at the end of the day, when you shut down your computer and restart it, it's cleaning all those unnecessary files. That's kind of what you do when you're resting and you hit that deep and REM sleep. So it's required. And you can't do it with less than 4 hours a day. Trust me, I try all the time.
I know. I keep asking God for another 12 hours a day to get through all the stuff I've got going on right now.
Right?
But it's not happening, so I'm just an angry old man with not enough time on his hands. So
right. Going. So you asked me a question and I kind of want to circle back. So cognitive behavioral therapy is pretty much a foundation of talk therapy, and it basically disputes irrational beliefs. Now, rationally motive behavioral therapy goes a little higher. Basically, they do what's called taking out the masturbations. Legit, Dr. Ellis coined that phrase. I did not come up with masturbations.
Okay.
Even though I am a certified sex therapist, I didn't do it. So masturbations are about must, should, ought, need, all that finite language. You always, you never. I do a lot of marriage counseling, and I will tell you that is the premise of most, is the lack of communication or the incorrect communication. The different styles that people come at each other with. They don't learn how to speak to each other, so they can't resolve any issues. All they do is internalize everything that's coming at them, as opposed to saying, I feel angry when you don't take the trash out. So it's all about communication. I'm huge on that. So there is one that's not evidence-based, and it's called neuro-linguistic communication, right? And what is it? NLP. So neuro-linguistic programming. But I don't really agree with the programming part, but I do like the language that they use in some of the trainings, because it helps give that alternative perspective. Because someone who's coming at you is hyper-focused on what they know, the information they have. My job is to educate, give you a different perspective versus perception. Just because your sister-in-law looks like she ate a fart does not mean she's upset with you.
Okay.
Right?
All right.
Oh, yeah. I'm a comic therapist. I get called the comic counselor all the time, because I think laughter is good for the soul, and it establishes rapport so fast. Right. But I call trip the orgasm. I'm like, if you want the orgasm, if you're tired of foreplay, let me know. Like, let's go. Let's move the needle. Let's get going. See? And that's why me and Joe are friends. Can you tell?
Yeah, I can see this.
I'm like, let's get it.
Yeah. No, he had a great speech at our conference. And we're going to have the conference in DC, and definitely we'll ask you to come.
Oh, I'd love to
be a part. We're going to be bringing this awareness, because we do have to address this huge gap in education for the psychological, psychiatric community. And we need to get, more work between the therapy side and the treatment side. The drugs, the medications, when necessary, okay, but we have to get more work there. So, as we come up on to the end of the podcast, tell us a little bit more about how people find you, and then what do you have going on? What do you have, like, what kind of projects are you working on right now?
So many.
All right, give us top 3.
So I have been presenting, oddly enough. I presented at the University of Central Florida last week. They had a summer symposium, but the outline, he's the clinical coordinator, the guy who is the lead professor for the counseling department, I guess is the best way to say it. Dr. Bryce Hagedorn. Amazing. He's a Marine vet. And so he does summer symposiums, and he educates these counselors on how to treat veterans and first responders, because their brains are different. Us going to war for a country that we just graduated high school is a different kind of person.
Yes, ma'am.
So like the thought process is different, and that's one of the reasons I won't hire a individual, because after what happened with my ex-husband, when he shot himself, they sent me a crisis counselor. This crisis counselor was an intern. I was her second client ever, and she was fresh out of her master's program. She was 26 years old. And I said, you shouldn't even be hearing what I have to say, what I experienced, let alone trying to treat me. Like, this is not a good situation.
Oh, gosh. I mean,
and I throat punched her and I almost got arrested. So I work for the police force now. As a
good to have them on your side. There you go.
I totally would have been a homicidal lesbian. It is what it is. I'd only been gay for the state, though, but that's not the point. Not that there's anything wrong with that. I don't care. You fly your flag. I fly mine. You do yours. I always tell people, I said, normal is a setting on a dryer, right?
It is.
And my drum beats way over there and out of tune.
You got boots
So
in
if
the
you're cool
dryer.
with
What do
that,
you
come
do?
see me. So,
Yeah. So how do
um,
people find you?
I have a website. It's
Okay.
sempermodisllc.com. I think of the HTTP, yeah, whatever. So it's SEMPERMOTISLLC. And it's at gmail.com for the email. My phone number is 757-818-0499. Leave a message, because if you're not in my phone, you will go to voicemail. And I have a collective. I have a Navy CB who is a licensed clinician. I have Army, retired Army, another Army MP. I have people who work for the police force who focus on grief and loss. I have one who works specifically with children. I have another lady who's married to an officer, a current officer,
Mm.
and, just a collection of individuals who understand the purpose of serving. They understand trauma. They've had a lot themselves, and they've worked through their own healing journeys, which is, I think, is amazing. But I don't hire anybody under 30. Let me just put it that way. Like, you have to have some life
Some
before you come
experience,
in.
some skin in the
I would
game.
never ask, like I was exposed to a very difficult situation, and I just would not do that to anybody else. I'm going to
No.
treat you the way I want to be treated.
That's a good comment too, because we talk about children athletes and military a lot in the show, but we cannot forget our first responders, the people that pick up the parts, and oh, can you hear me now? Yeah.
I can.
So yeah, but we tend to forget our first responders. Those that pick up the parts, the body parts, that clean up the mess, that are responding and suffer that so much other types of trauma that obviously that end up in your good hands. So, Dr. Royster, I can't help you. I can't thank you enough for coming on the show. This has been
I'm so
amazing.
honored to meet you guys and the work you're
No,
doing. I would
you're
love to join your mission. Let me know what you
You're
need.
you're part of the family now, man. You'll be on the
Yes.
email list, right? We'll keep you posted. We do a lot of great stuff. We are producing an app now, a concussion awareness app for parents. It's a free app. It'll be out. And then for this area, we'll be listing all the concussion specialists and people that know how to deal with concussion related trauma, how to ask these right questions. The fact that
Right.
you were asking, I don't know if you ever heard of traumatic encephalopathy syndrome. There's only 4
Yes.
questions you have to ask to determine a high probability of a brain injury. And
Mm-hmm.
then now you have a point of causality, which causes parents and veterans and military guys to have a reason to act, right? I can fix this. With therapy and treatment and maybe a little bit of medication or whatever if I have to have it. But what you're doing is an amazing job, an
Well, the goal
amazing
is to
job.
be medication free. Even if you're on medication initially, that's fine. Do
Right.
what you need to move the needle and keep you from choosing between a bullet and a bottle.
Yes,
Like,
ma'am.
if you need a fixer for your anxiety because you're terrified all the time, it's okay. But now that you're on medication, now that you're not feeling those ruminating thoughts, those, tornadoes of emotions, and you can actually function, then come talk to us and we will work with you, because I don't know anybody that goes, I love my meds.
No, I haven't met one yet either myself. None.
Right?
No.
And we're not designed to be on medication for the rest of our lives. It's like, that's okay for now. It's fine for now. Do what you need to do for now. When my best friend took her own life, she was on her medication.
No. I mean, it's
She
just
still made that decision. And then I had to deal with survivor's guilt for 25 years because I thought if I came home from the restaurant earlier, I would have intervened. And then what? I was active duty. I had to go to work.
all right.
So it would not have mattered. She had made her decision. And sometimes I think we don't give ourselves that grace or that space to realize that it's not on us sometimes.
No, ma'am. We are harder on ourselves than anybody else, and we do need to learn to love and like ourselves. And you're right. Just give ourselves a break, man. We don't do it.
So right now I'm working on, like I said, I'm furthering my education. I'm getting another doctorate in traumatology, specifically kind of honing in on some of the, I'm tweaking my protocols and doing different things, but also I do a lot of presentations at critical incident stress management trainings. I train on serious mental health, what to look for, how to respond, especially, I played college volleyball. So, they don't have helmets, but I'll tell you what, you miss a bump, you hit your noggin.
That
floor
ball
is
moves
hard.
too. That ball moves too, man. You get creamed and you get smacked in the head with that ball. There's no joke.
Right. I went to a small high school. I played middle linebacker. I played, just all different things. So I can't imagine how many concussions I've had in my lifetime. I can't. I drove a three-wheeler. I'm from Michigan, so we drag raced. We did hard stuff. Yep. So I would be a little concerned if I had an MRI in my head. I'd be like, whoa, what happened there? No. So I get it.
No. Well, you are now part of the family, and we thank you for coming on the show. We're gonna, thank Marissa for actually inviting you. We will have the conference. We'll keep you posted on that. Any new work, any papers you write, anything you have that can help veterans, parents, children, athletes, please send it our way, and we'll get it out on social media. And I cannot thank you enough for your time.
I am writing a book, and it's called "Why Am I So Mean to Me?" And it's focused on.
Love the title. Love the title. No,
it's
that's
focused
great.
on. Thank you. It's focused on what I've learned in the 15 years I've been doing mental health stuff is that people beat the snot out of themselves.
Yes, ma'am.
And my thing is I dig that down with each client, but at the same time, why does it need to be there? Because we're afraid to be a narcissist? That's like being resilient. Those two words are just buzzwords to me. It's like, well, do you have that diagnosis? 1, 2. You came to therapy. So are you truly a narcissist? This I need to know.
If you're trying to help yourself,
Yeah, they don't normally do that, nor do they, take any accountability for their behaviors. So if you're sitting there going, I was in the wrong, I screwed up, you're less likely to have personality disorder than someone else. Doesn't mean you don't have tendencies of narcissism, but doesn't mean you have a personality disorder either.
Well, you let us know when that book comes out, and we'll go ahead and blast that all over the place.
So we're doing a lot on moral injury and talking about that. And that's basically the dichotomy between your core beliefs and values and what you're ordered to do, sometimes in the military, sometimes in policing, sometimes by your parents. Right? You don't believe that this is something you should do. However, the abuse wheel continues, right? So it's building that foundation back up, bringing it down and building it back up, just like the military does. I mean, they take you to basic training. Well, I was in the Air Force, so I don't know if that really counts.
That was kind of a country club there. That's not really the military, man. I went to war with the Air Force. It was the best out of 4 different combat zones. It was the best time I ever had. I mean, it was great.
Yeah, we do have amazing food too. We always had to take money to eat your food. Yeah, that's true.
And beer. Well, folks, the Dr.
Jay,
Janelle Royster.
Dr. J is good.
Dr. J, I love Dr. J. Cannot thank you enough for your time on the show today. We're definitely going to have you back on. Please stay in touch and let us know when that book comes out.
Thank you. Will, thank you for everything. Anything you need, let me know. If you want me to connect with somebody, I'm happy to. I'm just honored to be here. And
Joe DeTuri, that's good enough for me, man.
He's a good dude.
He's going to be on the show pretty soon, too. We'll get him.
Yay! That's